In this video, we're going to be talking about the AOTA Code of Ethics. We'll be unpacking what these principles are and how we can remember them so that they become second nature. I'll also show you at the end of the video some memorization tricks and a simple and effective visual overview that I use to remember the AOTA Code of Ethics. Let's dive in. Don't approach a narwhal and say, Arno told me to do it. Stay safe out there. Welcome to the OT Minute. My name is Arno. I'm a third-year occupational therapy student. The AOTA Code of Ethics guides the ethical reasoning and conduct for all OT practitioners. Now, to be fair, this topic does not get a lot of love because it isn't always that exciting to talk about, but it's unbelievably important. It's pretty sobering to think that even one bad ethical decision can lead to losing our licenses, our self-respect, our reputation in the community, and really everything that we've worked so hard to achieve by going to graduate school, studying, and working with clients and cases. It can literally be gone in a blink of an eye if we don't put these ethical principles into practice. To begin our discussion on ethics and ethical principles today, let's start with a few terms that you may run into when studying or reading about ethics. The first term is compliance. This refers to knowing and doing the right thing according to laws, regulations, standards, or policies. You'll hear this term often in relation to compliance trainings. Essentially, these trainings are aimed at helping people answer the challenging questions about what's the right thing to do according to laws and regulations regarding a specific topic such as HIPAA requirements and guidelines. The second term is moral disagreement. This is super straightforward. It is simply referring to two or more people disagreeing about what is right or ethical. The third term is moral vagueness. This is when what is right or ethical is not clear because certain facts, values, or possible consequences just isn't clear. For example, if a healthcare worker implements an experimental intervention, certain facts are unclear about the intervention, including possible outcomes or risks. This would be an example of moral vagueness. The fourth term is ethical dilemma. This refers to a therapist being faced with an ethical challenge where two or more ethical principles are at odds. I'll give an example in a little bit as we go through the ethical principles. The fifth and final term is ethical distress. This is when you know the right thing to do, but there are factors that make it difficult to do the right thing. For example, you may feel that it's important for a client to continue receiving treatment because you know that they need it and may suffer further injury or poor outcomes if they don't get it. But insurance says they cannot pay for a longer stay in your facility and the physician has gone ahead and discharged the patient. This is a simple example of how ethical distress can become difficult personally because you know that it is ethical to continue treatment, but there are barriers to providing services. Now that our ethical vocabulary is on point, we need to address common ethical theories that guide ethical thinking. Understanding ethical theories will help us understand how people, including ourselves, are processing ethical dilemmas because these ethical theories are, in a way, the glasses through which a person sees and processes ethics. Sometimes we can beat our head against the wall trying to figure out why a person isn't understanding our ethical perspective and why their thinking and decisions are so different from ours. These theories will help so that you can really understand why people process ethical values so differently. The first theory is deontology. When thinking about deontology, think duty above outcomes. The mental picture of this theory for me is a soldier that sees it his or her duty to defend their post, even if it costs them their life, because their duty is to defend their post no matter the outcome. Therefore, someone using deontology as their guiding theory makes ethical decisions with the main question in mind: what's my duty? The next theory is teleology. This is essentially the opposite of deontology. Teleology designates that outcomes is the most important thing to consider when it comes to making ethical decisions. Therefore, whatever brings about the best overall outcome is the ethical thing to do. That can mean that even bending moral values can be okay as long as the outcomes are desirable. The third ethical theory is virtue ethics. Virtue ethics makes the decisions of what is the right thing to do based off of the question, what would the ideal or virtuous person do? This theory implies that society or the individual essentially has an archetype in their minds that they believe is the model for ethical decision making because they exemplify an ideal character. So let's apply these theories to an OT example and compare them. Say we have an OT who has been working at a site for a while and has just been told by their supervisor to cut their evaluation times in half because they're taking too long. If the OT is using deontology as their ethical framework or theory, they may feel that it's their duty to do thorough evaluations for each client, period. And that can't change. There's no compromise because it would be unethical to change that. The outcomes or consequences of the OT's long evaluations, including coworkers having to take on extra clients, and the OT's reputation suffering because of growing frustration from coworkers and supervisors. All of those outcomes are secondary to the importance of the OT's sense of duty and responsibility. Now, if the OT uses teleology as their guiding theory, they may think to themselves, what can bring the best possible outcome for the most people in this situation? If I skip some documentation steps or copy and paste some sections of my notes, then I can get my documentation done in half an hour. This will mean I can meet the needs of my supervisors and peers while not really having a noticeable drop in quality of care for my clients. Not only that, I can also keep my reputation intact. If the OT is using teleology as their guiding theory, this may seem like the best overall outcome, and therefore that would be the most ethical thing to do. If this same OT uses virtue ethics theory, instead of looking at duty or outcomes to make an ethical determination, they might think of a societal moral code or what they think a person of good character would have done in this situation. For example, if they are religious, they may think about what their religion teaches about what makes a person of good character, and that would be the guide for the OT as to how to make an ethical decision regarding what she or he should do about the pressure to decrease their documentation time. So let's do a quick recap of these theories in super simple terms. There are three theories. First, deontology makes ethical decisions by considering duty above outcomes. Second, teleology considers outcomes above duties. And third, virtue ethics theory considers character above all. Now, to be fair, these definitions and examples are gross simplifications of these theories, and each has a lot more depth than what we have time for today. But I hope this gives you a sense of the importance of these underlying theories in guiding ethical reasoning and how complicated it is when you're working with a diverse team of people with various underlying ethical theories. If you find yourself bored or wanting to know more, I have posted references and resources below. Now for the meat and potatoes of what we're talking about today, the AOTA Code of Ethics. There are 6 ethical principles included in the Code of Ethics. Let's go one by one. The first is beneficence. This ethical principle states that OTs need to act in ways that always consider what is good for the client and their well-being. This should probably go without saying, but just in case you forget, this principle keeps us accountable. The second principle is non-maleficence. This principle guides occupational therapy practitioners and students to always consider ways to prevent and minimize risks of harming a client. The third principle is autonomy, which instructs OTs to value the right of individuals and clients to make decisions for themselves and to have control and self-determination over their lives and their healthcare decisions. Now, I want to add a quick side note here. The principle of autonomy, along with beneficence, provides a good example of an ethical dilemma that we talked about at the top of this video. For example, a client might feel that they want to be discharged prematurely while the therapist believes it's best if they continue receiving services because there are serious safety concerns if the client is discharged. In this case, the OT would be balancing the principle of autonomy, aka respecting the client's right for self-determination, and the principle of beneficence, which means seeking the well-being and good of the client. Since these ethical principles are at odds and you can't have both at the same time in this case, it's an ethical dilemma. All right, back to our list. Fourth is the principle of justice, which emphasizes that OTs should seek to be fair and equitable toward their clients and seek justice and equity. Justice applies to individuals as well as whole populations. For example, if an OT is working in a corrections facility and inmates are experiencing extreme deprivation of occupational opportunities and there's occupational injustice, the OT's Code of Ethics guides OTs to consider their responsibility to advocate and seek justice for and alongside their clients, no matter who they are. The fifth ethical principle is veracity. This emphasizes that OTs need to be truthful and honest in all aspects of their practice. This includes telling clients the truth, documenting accurately without leaving out necessary information, and representing yourself accurately regarding credentials and skills. The sixth ethical principle is fidelity. This principle sticks out to me because it's more about how we act towards other healthcare disciplines or professionals than how we treat clients. This principle instructs OTs and occupational therapists to respect other disciplines and treat them fairly and with integrity. Now that we have a good sense of what these principles are, let's review some tips and tricks and how to remember and memorize them using a simple visual breakdown that is so simple it can fit on the back of a note card. But before we do, please take a second. I'd love to hear from you to share in the comment box below what ethical challenges you have seen in your field work, rotations, or out in practice. Here is a visual of what we've talked about throughout this video. So let's start with the lovely terms. One tip that I always encourage is, if you can, don't write the full word, just write the beginning letter when trying to synthesize all this information, remember the words, because you want your brain to take over and know these terms without having to cue them as much. So for C, I know that means compliance, especially if I look at the definition here, which is all about laws and regulations and knowing how to be compliant to those laws and regulations. Moral disagreement, I know because obviously it says disagree, and that one's, I feel like, so straightforward. Moral vagueness, again, this is about questioning facts and outcomes. Ethical dilemmas, it's really two principles going head to head, so it's a backwards P if you can't tell because of my great artistic skills. And then fifth is ethical distress. It's about the distress that you experience when trying to do the right thing but are experiencing barriers to doing the right thing. All right, let's talk about principles. If you have a kind of trouble remembering what the principles are or what they start with, got this handy little mnemonic here. Beneficent narwhals are just very friendly. That just helps to cue me on. B is about beneficence, and M or N is about not doing harm or non-maleficence. Autonomy is about giving control to the client, letting them make decisions about their own healthcare. J is for justice. A courtroom gavel is a good visual cue for me. And the veracity is all about truth-telling. So this is a little Pinocchio with his nose growing because he's not practicing veracity. And then F stands for fidelity, and this is all about how OT practitioners need to show respect and appreciation and integrity to other disciplines like PT, doctors, whatever it is. So this is a little OT tipping his hat saying, well done, good sir. Here we've got our theories, deontology, teleology, and virtue. If you have trouble kind of remembering that, you can switch around to do DVT, which is the same breakdown for deep vein thrombosis. It just helps me to remember, okay, those are the letters with which these theories start, D, V, and T. Deontology is duty above outcomes, and D starts with D, so if you kind of use this, it's easy to remember which one's which because the D comes first in deontology. And with teleology, outcomes is greater than duty. The third is virtue, which is all about character, and whether it's a moral character, an ethical character, a virtuous character, what would the ideal person do in the ethical scenario, and that's how you make an ethical decision. Also, just want to make sure that you are aware that I actually don't know if narwhals are beneficent or very friendly, so don't approach a narwhal and say, Arno told me to do it. Anyway, stay safe out there. Thank you so much for joining me on the OT Minute today. If you haven't already, please consider subscribing and turning on the notification bell so that you are kept up to date regarding new OT related content coming out. Feel free to post this video and share it so that we can continue to build the OT learning community. We'll see you in the next video.